Let's get the show on the road here.
Okay, first off, we need to get approval of the minutes of June 25th and August 10th meetings, please. Thank you. Ms. Duncan, Ms. Daly on the second. Any additions or corrections? All those in favor, please state aye. Aye. Opposed? All right, we'll jump right into the budget book, the yellow pages. I think Scott has the slide deck for us.
I do.
Oh, yeah. Let's put it on the floor, just discuss. Can I get a motion? Thank you, Mr. Ricker. A second? Thank you, Ms. Coates.
All right. Thank you, Mr. Chairman. So obviously we're running a little bit behind, but we want to be sensitive to the needs of this committee, but we'll still run through the materials. So recommended budget is divided into sources, or the revenues, where the money comes from, and uses, which are the expenditures, or where the money goes. Across all funds, sources are recommended at 150.62 million. The largest of that is intergovernmental revenues, where we get sales tax, income tax, personal property replacement tax, grants, and salary reimbursements. Uses are 154.9 million, and the biggest chunk of that is our most important asset, our workforce, and it's 60 and a half of that 154.9 million. Property taxes, we're recommending a rate of 82.41 cents per $100 of assessed value. This is been the board's rate for an exceedingly long time, and so we've kept that consistent with prior board direction. When you apply that rate to all taxable property in Peoria County, you'll get a levy request or recommendation of 31.34 million. It is divided by the various pie wedges you see on the chart. The ones that are shaded in blue or gray are our operating funds. The ones that are in yellow or tan are the pension-related funds. There is not a third color this year, which is the debt service fund. That's because the recommendation is to not have a debt service levy this year. And that's because, based on a resolution that it's at Finance and Executive Committees later this afternoon, alternate revenue sources exist to make the payments on all the other outstanding bonds that would be subject to the debt service fund, including the museum bonds. I will note, though, that one of our operating funds is Headington Oaks. We levy an operating property tax in that fund, and then we turn around and use that to make a bond payment for the nursing home bonds. We're recommending the full 6 pennies there, provided the board does that, and provided future boards continue to levy 6 pennies. You will have a substantial nest egg to either make a substantial down payment on the remaining principal in 2032 when you can refinance those bonds, or perhaps pay them off in full. It'll just depend on how investments go and future decisions of future county boards go. But obviously that is going to be our recommendation going forward. The levy goes up by a couple $1 million this year, and that's because of increased property values of 6.7%. In terms of the oversight of this committee, there are 4 budgets that you have oversight of. 1 in the general fund, 3 are separate special revenue funds, and you can see that your oversight includes $9.7 million in revenues and $10.8 million in expenditures for next year. How does that relate to the entire budget? You've got oversight over 7% of the revenues and 7% of the expenditures. Because you do have a general fund department, we like to show you what the general fund looks like. It is the recommended budget is a balanced budget between revenues and expenses at $56.77 million. Again, intergovernmental revenues is our largest revenue stream, and our workforce in the general fund is our largest expense. The Regional Office of Education is the only general fund office that or department that you have under your jurisdiction. Their revenues equate to less than 1%, and their expenditures round up to be 1%. That, Mr. Chairman, is the slide deck. Before I hand it back over to you, just like to acknowledge the work that the departments have done to get us thus far in the process, and to thank the finance team and Heather and her team for pulling everything together. As I've said at every committee thus far, in January we implemented a new enterprise finance system called Munis. We also implemented a new software-based platform to build the budget book called Pattern Stream. Pattern Stream talks directly to Munis, but doing it for the first time with new software proved both challenging and sometimes frustrating. But we have the book here in front of you, and we're happy to answer all of your questions.
Thank you very much. Yes, and thanks to our finance team and everybody. We appreciate it. Yes, Brian, did you have a question?
Scott, are there a couple of those slides where the graphs go horizontal that are not in our book? I might have missed them.
So,
is that in our book? I might probably missed it.
so this would be not in the yellow pages, but you would see it presented differently in the front of the book.
Okay. Is there any way you can just email us that in that form?
Yes.
Okay.
So yeah, Mr. Elsesser and all of you, if you haven't refreshed your iPads in the last day or so, feel free to do so, and this slide deck will be on your iPad.
Thank you. Thank you for that.
Okay, does anybody have any questions regarding the budget for any of the departments that are here? We did. Yes. Oh, yes, we did. Thank you. It is open for questions from members. Yes, Member Williams.
Thank you, Mr. Chairman. Scott, I wanted you to give an explanation of the fund balance in the solid waste management. I asked this question in our private meeting about the HHS campus. So can you give an overview of that, please?
Happy to do so. And for everyone involved, let's turn to page 34 in the yellow pages. And you'll see in the middle of the page the fund balance reporting for Solid Waste Management Fund. So Solid Waste Management Fund, for everyone's benefit, those revenues come from tipping fees at Peoria City County Landfill, and then any interest income that the treasurer may generate through whatever cash is on hand in the reserves of this fund. These funds are segregated and can only be used for solid waste management, recycling, sustainability type projects. We do recommend, or we included, maybe rephrase, we included in the funding stack for the HHS project a total of $500,000 of use of fund balance from this fund. The first $250 was actually done in either FY21 or 22. So 21, I believe. So it was actually the first money in. The second 250 is currently programmed to be the last money in, so that would be sometime next year if it is needed. Again, we've got a pretty substantial contingency line that if we maintain that, will be several $100,000 under budget on the project, and those expenses will not be necessary. As it relates to what's left in this fund balance, and as other members have raised some concerns during this year's process about large fund balances, this is a special revenue fund where we've got specific uses that these dollars can only be used for, and the revenue stream is beyond our control. We get those revenues whether regardless, but the concern going forward, and this is where this fund balance could be used, is the current status of landfill 3. Landfill 3 should be opening in the next several months. It is not going to be opening in the next several months. There is going to be probably a 3 to 5 year gap where there is no landfill 3. And landfill committee is City County Landfill Committee, which Ms. Williams sits on, is actively working on that issue and what that means. But part of that negotiation, from my perspective as the administrator, is ensuring that the revenues that typically and historically come to this fund are going to continue to come in whatever solution gets negotiated with the operator.
Scott, can we at some point have an update so the whole health committee knows what's going on with landfill 3?
Yeah, we can do that as early as probably next month if the chairman would like that.
While we're on the solid waste management fund, on page 37, what's the difference between an indirect IT user fee and a regular IT user fee?
37.
What page is that?
Page 37.
Yellow 37.
Yellow 37.
So I don't see that there is a direct.
There isn't a direct.
Okay.
It's just
So trick question.
what does indirect mean? What does indirect mean?
So it's an indirect. So an indirect cost is something from an accounting perspective where it's not specifically borne by this department. They pay for that service, and so you'll see as two other examples that are listed, but only one of them is budgeted, is an indirect cost for fleet maintenance. The recycling department does have one of the 173 non-highway department vehicles assigned to it, and so there's a cost that this department and this fund bears for helping to maintain that vehicle over the course of 12 months. So it's anything that a service is provided to this fund has an indirect cost associated to it from another internal department.
And this is because it's a special use revenue source.
Right, so this is a special revenue fund. It is not part of the general fund.
Okay, thank you. Does anybody have any other questions on solid waste before we move on to another department? Okay, any other questions on any of the other departments? Yes, Mr. Ricker.
On the solid waste, in our prior meeting on operations, we had Mr. Sorrell give us an explanation for the additional head count for staff and sustainability. With the challenge of landfill 3 being delayed and potential funding challenges for that, I'd like to at least have this committee or the right representative committee maybe oversee that we may decide before the end of the year to make a change to that addition if we don't have funding to fund that position, if tipping fees go away and our share of tipping fees go away. So I'd like that to be an option before the end of the year, if we know enough.
Understood.
I agree.
Yep, good point. Any other questions on solid waste? Okay, how about any of the other departments? No, we're making it easy on them. I'm just going through maybe some of the questions that I had for Scott initially. One of the questions I had for him was on the health department and the dental clinic and what the U of I's contributions would be. So I don't know if you just could share that.
Sure, happy to do that. And if I don't answer this completely or correctly, I'm going to ask Monica to expand upon my comments. So dental clinic, as you know, we are going to have a partnership with both OSF and Heartland Juvenile Adult. The way we've got the equipment structured is we're going to, as part of the project budget, we're going to front load the cost of the equipment, and then we'll recapture over time through a lease of that space those costs.
Is that accurate? Okay, thank you. So a lot of the benefits that we're going to see from the HHS campus that we talked about during deciding on whether to do it or not, we won't see for a couple of years yet. But I know one of them that I talked to Monica about is the efficiency in staffing of only having one point of intake. So that's something we won't see for a couple of years yet. Any other questions? Yes.
So we will be doing adult dental then?
Monica, come to the microphone.
So our current process that we are working with the OSF residency program is to bring adult dental services alongside what we already have in existence, which is the pediatric clinic of the residency program for dental services. So for those of you who may not be familiar, our dental clinic has a long standing of being actually a teaching clinic. We support the residency program in dentistry to do children or pediatric services there, along with some of our other higher education to do dental hygiene programs as well as dental assistant programs. So not only do we provide our services, but then we also leverage these higher learning institutions to help support and fill gaps in staffing, but also be a teaching institution as well. Our goal in the new facility and what we've been working on is actually expanding that to add the adult side so that it becomes comprehensive, one-stop shop for families to be able to have that, as well as sustainability of our dental clinic. When you have two operating structures happening at the same time in terms of precept or oversight, it can be challenging. And so by putting two of the teaching residency clinics together, it alleviates some of the burden of finding backup. And so then we have consistent residents able to provide services.
Well, I'm really glad because adults cannot find dental care within 200 miles of here. So I think that is going to be very important. And then will you continue to do dental services for persons with disabilities?
Yes. So one of the funding streams that we do have in the budget we've had historically has been with EPIC to support providing dental care with individuals with disabilities. In fact, we took that longstanding recognition with our history with EPIC, and when we were designing for the new facility, made sure that there were spaces that were sensitive to motion, making sure there was enough space for wheelchair accessibility, as well as for guardians or support staff to be able to have space for them to wait and assist. And so we are fully hoping to continue that in the new site, and actually built and designed to make sure we could keep that partnership going.
And then I guess my last question is, will is somebody going to get reimbursed for the adult dental work that's done?
So in terms of the reimbursement structure, this is part of that negotiations that we're working with OSF Dentistry on to see how they want to structure that. It could, as Scott alluded to, depending on what kind of a lease agreement we go with them, if we are strictly landlord and renter, they are then responsible for their billing and their reimbursement separate from the health department budget. It could be some type of hybrid where they are very much intermixed. But I think that's things that we're navigating through as we continue and expand this partnership.
And I can't remember, does the federally qualified clinic, are they able to get reimbursement for dental services?
So the FQHC, or the Federally Qualified Health Center, and that would be Heartland, they actually get the highest rate, I believe, in
Right,
reimbursement.
that's why I brought that up, yes.
Now, historically, the health department, especially in recent years, they've also received increased reimbursement for pediatric services. So we've taken advantage of that over the past few years. And even in our budget, you'll see you'll see the revenue increase drastically because of the new rates that we're able for pediatric. Currently, the model we have in Peoria, though, is Heartland leases the space for the adult dental program or clinic, but they do not get reimbursed. It is all handled through OSF, and that's the model that OSF and Heartland have come into agreement with. Will that change in the new facility? Again, that is something at the table as well.
Thank you.
Yes, thank you. Any other questions? Okay, thank you. All right, all those in favor of the budget as presented, please state aye. Aye. Opposed? All right. Next, we're on to informational items. Board of Health.
In your packet, you'll see 2 minutes for our past 2 Board of Health meetings. Wanted to highlight a couple of things. The first is part of the distribution of the Health Equity Fund. The board met and approved the first 2 project allocations for that process. And so that will be focused around housing and the impacts of housing and affordable and habitable housing for health. And so we started the process for the Health Equity Fund distribution. We're also, today, actually in a few minutes, we will be closing the second RFP related to cure violence for the south side of Peoria. So we hope to be awarding the next community-based organization to start doing that work as well. And then lastly, just more than happy to answer any questions you might have, but we are right now working towards bringing on the 2023 COVID vaccine and kind of that release. I think there's a lot of confusion about it right now. Largely, during the pandemic, it was a federal asset, and now it's going back to what we consider private or kind of standard processes in terms of distribution and development. So we are not going to see those large mass vaccination clinics. The health department, we know we are procuring vaccine. We have yet to get delivery of it. I know our local pharmacies received their first shipments and have started distributing it out as well. And then our hospital systems and their office groups are also pushing it out here in October. So we hope to see it build. I know there's a lot of interest related to it. It is what's known as ACIP recommended, so private insurance does cover the cost of it. But we are recommending individuals that have questions about it to reach out to their insurer first and foremost.
Is it the same 2 manufacturers?
Right now there is. It's Moderna and Pfizer. There is a third, and they're still going through the processes as well.
Okay, thank you. Any questions? How about care and treatment?
I have no update for care and treatment.
Okay, thank you. Is Jason here for EMLA? Or you also?
All of the above.
Sure.
Jason is unable to be with us. He is just coming back in town. He's now a grandfather for the first time, so we're very excited for him.
Congratulations.
But we've been, first and foremost, thank you for the proclamation. I believe City Council is also doing a proclamation tonight for emergency. We are kind of resetting ourselves again in full awareness. During the pandemic and prior to it, we transitioned to be both the county emergency management agency as well as the city, so it's now all collaboration under one. And really trying to focus and re-engage the group into long-term planning. So Jason has started hosting kind of strategic events and meetings with all the disciplines that would be in response, start kind of gearing up and planning for a long-term how we'd like to see EMA support the entirety of our population and kind of long-term planning. And so he started that process. there might be updates that come through this committee if there's large changes in terms of our hazardous vulnerability assessment, as well as large grants that he is trying to seek out from the CDC as well to bring in training and support.
Nice. All right, thank you. Do you want to do Beth's while you're here also?
Never.
Okay. You were ready for you. Welcome. I'm sorry we didn't have any questions for your budget.
Well, when you're less than 1%. So what I want to talk to you about is what I'm using that less than 1% to leverage to do other things, because the staff that you provide allows me to go out and apply for a lot of other grants. So I was at that Jason Marks meeting. Like, there were a lot of people in the room, chiefs and fire chiefs and all kinds of folks. And that was a really great way for us to connect. And a lot of those folks went out to Illini Bluffs last Friday, did a reunification drill. That is intense. So the entire school evacuated and went to two local churches. Primary went one way and middle and high, and then they reunified. They give parental permission. It's a great exercise for everyone to engage in. So there were a lot of people out there Friday afternoon. All right, a couple things. One thing that we do, all in alignment to our mission of service at the regional office, professional learning is back. During COVID, there was a lot of pause on those kinds of things. People didn't want to get together face to face, and they were meeting immediate needs around COVID, and now they want a lot of things. So we hired 2 new people this summer. They are focusing on the continuous improvement process, looking at data and what's going on with school and helping districts to make those plans and embed professional learning to help them achieve those goals. And so I'm very excited about that. And their phone is ringing off the hook. Their calendars are already planned out almost all the way through the end of the school year, which is June 2024. In addition to that, we serve with student services. So as you know, we have a preschool for all. Folks, I am struggling with staffing. I'm to the point of, how do I even keep some of these classrooms open, because I can't find a licensed teacher for the early childhood level and paraprofessionals. I am just struggling. We applied for additional dollars, but thank goodness we didn't get them. We couldn't have opened the rooms if we wanted to, because I just can't find the staff. But we have 4 classrooms still, 2 at St. Paul Baptist Church and 2 in the Bartonville area, 1 at Hollis, 1 at Oak Grove. Peoria Regional Learning Center still going great. Over there in West Peoria, still struggle with some staffing there, but we're okay for right now. Our truancy staff is knocking on doors, and it is a nationwide issue. I don't know if there is at some point, somehow, some way that we could have a sidebar discussion about what we're seeing in Peoria County, because it is catastrophic. We are finding 7 and 10-year-olds that have never been to school. We are finding students missing 20 days, 80 days. And student achievement doesn't happen if you're not there. So we are really working on that. Lastly, I wanted to leave you with some of the new grants that we have brought into the Regional Office of Education, and it's kind of overwhelming me because it's a lot of processing of paperwork and systems. So First Thread is called a TVVP grant. It's a violence prevention grant, but it's a federal grant. And so we had a grant writer do this for us, and we were awarded it at $680,000 for a statewide regional safety director that will be working across the state with the Illinois Terrorism Task Force to align school safety initiatives, efforts, and put all those things in place. We're really proud of that one, but the regulations for federal grants are kind of blowing my mind. This is a new one for me. With our City of Peoria grant to target violence, we have hired a director for that, and she is based out of the Tree Wind Wraparound Center. She's going to be helping us develop a truancy advisory board, which leads to a other state grant, $5.5 million that was awarded to our office through Jahan Gordon Booth's efforts. And that grant is going to do a lot. It's going to improve facilities, it's going to improve safety, and it's going to do a lot around professional learning and supports out there in the districts. Behind the scenes, what we're trying to do in the regional office is systematic change. we can go along, you know, the story of the starfish, and we'll help this kid if we can and this kid, but if we bump into this kid, we'll try to help. But there's some systematic change that needs to happen. And so when we go knocking on doors and find these kids that have never been in school, there needs to be an entire process that happens. And we've got a lot of people doing great work, but it is not aligned. So we are working on some of those issues. That's a lot. It's a lot of money to be responsible for, and we want to do the very best job that we could, especially after your auditors just left. Like, so on top of everything, we're writing all this stuff, and our auditors were here last week, but it went really, really well. They said so far everything looked great.
Great. Any questions? I noticed you left out Career Spark. What's that?
Career Spark. How can I forget Career Spark? Oh, it's my favorite event, and it's this week. Come see it. It's this Thursday. It's this Friday. It's all day at the Civic Center. Every major industry and different career clusters and sectors are going to be represented down at the Civic Center with hands-on activities for 8th graders. We're going to have over 5,000 8th graders from all across Central Illinois come through it. They have the linemen out there showing them with the actual, like, how they do the lines. One time we had molten stuff they were pouring like they do at the foundry. They have the medical robots. They intubate pig lungs, and it's great. We have kids pass out. We're like, you don't want to be a doctor. That's awesome. Go try another sector. It's been proven that by 8th grade, they need to have a career experience. So it's from 8 to 2. There are VIP tours if you want to come see it. We've been doing this now since pre-COVID. It's a great event. Greater Peoria Economic Development Council with Junior Achievement and lots of other partners like us.
You said 8 to 2?
8 to 2, Thursday, Friday in the Civic Center where they used to have the March Madness experience in the big hall.
Awesome. I'll be there because I got to go get my Journey tickets Friday. So I'll be there.
That's interesting. I might have to do that myself.
Yeah. And Toto. Any other questions?
Forgot about Career Spark.
All right. Thank you very much. And last but not least, we have the Sustainability and Resource Conservation. Hello, Becca.
I just have a few quick updates. We did opt into SERA again, which is the Consumer Electronics Recycling Act, for 4 single-day collections in addition to a permanent collection. We've really relied very heavily upon that permanent electronics collection site, as they would be the one that is accepting everything. We continue to try to do education around that. And with that said, today and tomorrow there is a collection in Limestone Township. We really are working with that permanent site to make sure we're reaching all of Peoria County, so that it's equitable for all residents if there's transportation issues and that sort of thing. So we are doing a closer one for those residents of Limestone Township, which this will be the 3rd year for it. 250 households were registered, and we did promotion around that, as well as sending out some postcards. They also are doing a couple of cleanup events. One was on the 23rd, and the next one is on the 30th at the Eagles Club for their residents. Tazewell County Health Department takes a different approach to electronics collection. They do a 1-day collection for all residents, and that is October 7th, but it is open to anyone in the state of Illinois, 7 to noon at the East Peoria Festival Building. Our partner in McLean County just hosted their Household Hazardous Waste event, and they were capped at 1,000 participants. We were capped at 600. So they had a very successful event. We sent a few people that way for sure. What else? In terms of education, just one big outreach this month, and that was to Food Handlers Association in LaSalle County, talking about composting and making sure that we're sort of reducing barriers to composting in commercial establishments. And it wasn't just for LaSalle County, it was just hosted there. And then otherwise ongoing education on sustainability campaign. The landfill committee, there will be an update next month on that, but it is very much the same as what has been reported in the past. That it's a little bit of a standstill with the DNR's abandoned mines section department being willing to fund a few of the repairs that are needed. But in terms of moving forward, we're waiting on the IEPA. Regional Food Council, there was a third workshop. We were trying to do 3 this summer. There was a third workshop held September, it was still summer, around Illinois State Board of Education's Local Foods to School program to make sure schools know about that, as well as the local foods procurement funds that are through the USDA, whether that's through the grocery store initiative or direct farm to pantry. The United Way campaign kicked off today. I serve as the county's campaign chair, so that runs today through next Friday the 4th. So that is, we've got some pretty fun activities for that. And the sustainability update, I do have the utility usage for the first 6 months of the year. You'll see a reduction overall in natural gas and electric. Most of that is attributed to the health department being offline, or no one being in the building, and then all of the accounts were offline by March, April, with the exception of the garage at the health department. I did call out the courthouse natural gas reduction. You'll see the chart there, the second to last chart there, and that is mostly, I wanted to pull that out so you could see the effects of the new burner that was put in at the beginning of this year. And then also jail natural gas reduction, I pulled that chart out. They are doing a little bit of electrification with their dishwasher specifically that runs almost all day. And also it would be a reduction of steam, which, you know, just kind of keeps for a cleaner facility as well, and keeping the kitchen a little drier and less pests. So I wanted to pull those out, and that is it, unless there are specific questions.
Thank you. Do you want to give us a little sneak peek as to what can expect next month?
For the landfill committee? Or for, yes, sorry.
That's okay.
I can tell I just came back from a week off. We do have the the solid waste plan was adopted by the county board in 2015, and that is required by the IEPA, just saying how we will handle solid waste generation or diversion in our county. We are required to do a 5-year update, and that fell kind of during COVID, and also at a time when all of the county coordinators were saying, this is really not a great way to, the reporting is not the same. So there was a materials management task force that reported back to the Illinois General Assembly saying, this is what we think that reporting should look like. We want to have more counties reporting, and we'll report as a state as opposed to individual counties to get a more accurate number. So during that time, we did submit our 5-year update, but it really was a worksheet. So some funding came available to do a more thorough update, and so we chose to take advantage of that, and also to really, you know, put forward where we were, what we had done. We had completed those tasks that were laid out in the 20-year plan, and then also what our intentions were going forward. So that is completed at about 99%. We did meet with the county's chair, the county's appointed person for the landfill committee, which is Rick Fox, and he gave us some suggestions of what he would like to see. We incorporated those, but we do not have a final copy from our consultant both. We wanted to just kind of touch base one more time to really just, you know, cross the T's, dot the I's, and get the punctuation correct. So you will see that next month.
Fantastic. Thank you. Any other questions? Okay. Any public comment? Miscellaneous? Yes.
I just wanted to quickly acknowledge the health department. I had a business owner in Peoria Heights reach out to me asking that I observe a process as they attempted to open, and they were really, what it came down to, pressed for time, and submitted a form to the health department to complete an inspection with little time, and they were pressed to open in a very short period. And I watched the health department just go above and beyond to get the inspection completed and get this business open. So I wanted to just quickly acknowledge them for their work It was amazing and shows how Peoria County attempts to be business friendly.
I agree. Yes, thank you. We're finally going to have a building that matches the level of service we provide. So, I agree. Any other miscellaneous? Okay, we're adjourned.